friends, I am Dr. Sanjay Sharma from JPRC Neuro Spine Centre, interventional pain physician. We are doing this interventional pain medicine practice from last 15 years from this centers, and we are catering the patient from India and abroad, right? The patient who are having the acute pain or the chronic pain, whatever the situation, means but the pain is not a pain. What the common people thinks, it is just a symptom. It is a complex disorder. It involves your brain, it is involve your mental psyche, it involves your physiology, it involves your biochemistry, it involves so many things. So it's a composite phenomena. Just saying taking this pain killers or something like this is not pain treatment or pain medicine. It involves the neurosurgery, it involves the neurology, it involves the physiatry, it involves the medicine, it involves so many complex branches of this medicine science, and so all come together and the final result come out. And we had with us today my patient, Dr. Avdesh Sharma. He is from the New Jersey, United States of America, and he was complaining me about his situation as a chronic pain. I am this problem, PIVD at L3, 4, 5 and L5S1 at both levels. So the most of the doctor in the US was saying go for surgery. This is the only last option which we can go for these things. And for this surgery, if any patient who is advised for the surgery, first he thinks we should go for the non-surgical option. And meanwhile, from last 12 years, as he was complaining, is some chronic pain in the knee joint because his weight and his lifestyle, because he has to travel a lot from one country to another country, so he was having this regular phenomena. So by taking these medicines and all these things, this patient could be sustained, could be relieved for a couple of days to week, and after that he has come to the same square. And meanwhile he sent me all the relevant documents, so I go through all things. Then I suggested him to go for this interventional pain medicine treatment. So for that we advise for minimal invasive techniques, minimal invasive procedures, where we can do a daycare procedure where the patient can be discharged, on the same day or even after 24 hours. So patient is not required for any hospitalization, no admission, nothing like that, no incision and no surgery, absolutely no surgery. Initially, it's not necessary for every procedure, it is a non-surgical. We go according to the situation of the patient and all things. So for that Dr. Sharma came and we decided what exactly was your perception before this come to my clinic for the interventional pain medicine.
Hello, my name is Avdesh Sharma. I'm 65 years old and I live in Cherry Hill, New Jersey. And I've been suffering from back pain for last almost 20 years. Every morning when I wake up, I always felt sore, and there was a lot of discomfort in my back. Then for the last almost 12 years, I've been suffering from knee pains in both of my knees, and it got progressively worse. And for the last 2 years, it has been sort of unbearable, and I wasn't able to, or I have not been able to, up and down and go up and down the stairs. Particularly coming down the stairs has been quite a challenge. I can never do more than 1 or 2 steps at the same time. And I've been following Dr. Sharma's clinic on Facebook and other media for almost like 10 years now. And my back pain actually led me to his Facebook page and all media attention that he has been getting over the last several years. Sure. Well, Dr. Sharma, as you suggested, that I have suffered with this pain for many years now. And in New Jersey, I went to several doctors. Either they'll give you very strong pain medication, which many times could be habitual, or they'll put a cortisone injection in your back and your knees. You cannot keep taking steroidal injections, for many years or continuously. And then I had gone through physical therapy for almost like 6-7 months continuously, and that was in year 21. So yeah, physical therapy relieves some pain to some extent.
But
And then it comes
taking
back.
these medication, because you are a scientist in the medical science also, in the pharma industries. So do you think that giving these steroid shots and the painkillers for the long time is justified for the patient in the long term?
No, it's not, because the steroids are extremely dangerous. See, I'm diabetic also, that
Yes.
then it raises the sugar levels more than 250, 300. That level, that's rather dangerous. And if you keep taking pain medications for a long time, then you can develop GI problems.
Yes, yes.
And several other things. It's not a safe this thing. So Dr. Sharma and I discussed alternatives, and he gave me a tutorial on what his procedures are, minimally invasive. There's no surgery here, and it is, yes, he does go into your spine and into your knees, but it's minimally invasive.
But for this minimal invasive technique, did you feel any kind of a hurdle or any kind of apprehension? And after the outcome, after the procedure, what was your reaction?
Yeah, actually, as far as apprehension, see, I'm a scientist. All scientists are always apprehensive about something new. It's not my area. I'm a chemist by training. It's not, medicine, practice of medicine is not my area. I can only make medicines. I can't prescribe anybody anything, and I don't know anything about his pharmacology or DMPK and whatnot. So yes, you have to be
very cautious. Very cautious about the result, prognosis.
For the lack of better word, rather suspicious of any new procedure. Then I read about it, and then when I was convinced, then we decided a date on which I'll travel to his clinic.
But this pain medicine is very common in the US, right? It's from last 20 years. I'm just going through this, because most of the doctors from the United States of America and from the UK and from other European countries. And so why didn't you opt for that treatment in the US?
Well, I tell you what, many doctors, the ones that I went to, nobody actually suggested that it could be minimally treated. See, that was one thing. Or maybe I just didn't hit the jackpot, let me put it that way.
Yes.
And then knee, usually the way medicine is practiced, I'm not criticizing anything here, it's just my personal view, that doctors don't give you many options. And that's where we were. And when pain got unbearable, then I came here.
Yes. So, as your case was for conventional surgery, open surgery for the spine, so were you in the belief that this pain medicine will help you?
Well, I read and I heard many of the videos that you put in there, and then I was following your social media, all articles in newspapers and all that, that many people had been treated successfully. And here I am.
So it's a great outcome for you.
Yeah, for me it has been exceptionally good. Dr. Sharma did perform procedure on Wednesday, I believe, right? Yes, it has to be Wednesday. That was 3 days ago. And so one day my leg was sore, and it was the first time in several years that last night I was able to climb up and down 48 steps.
Yes, it's a great achievement without going for any kind of a surgery, right? So then we can suggest the people for just instead of going with the conventional surgery or some other conventional techniques, we should go for a minimal invasive technique or minimal invasive procedure if it is possible. If it is possible,
sure,
then definitely we should go for these things.
Of course.
Okay, well, this was our experience with the patient and how this pain medicine is working in our field, just to relieve acute pain, chronic pain and other modalities of the pain symptoms and the procedures and their outcomes, and everything is clear. And the most of the pain physician as globally, you can interact with those doctors so they can help you. Okay, thank you.